Hello, everyone. My name is Ava Berman, and today I will be discussing the Plan, Do, Study, Act cycle as part of our workshop series on continuous quality improvement, or CQI. The CQI process is broken down into four main steps. In the prior two workshops, we discussed forming a CQI team and identifying improvement areas. And today we'll be discussing the Plan, Do, Study, Act cycle. And in October, we'll cover lessons learned. So, as Grace detailed in the previous pre-recorded workshop, root cause analysis begins the first phase of the PDSA cycle, which is planning. And I have linked her presentation here. So when you conduct root cause analysis, you are working to understand the initial cause in a chain leading to an outcome. You do this by identifying all the underlying issues that might be causes of the problem and the pathway that leads to the problem area. When CQI teams understand what exactly is causing an issue, they are more likely to develop a change strategy that will be successful in alleviating that issue. And if you recall, root cause analysis tools include brainstorming, the 5 whys, and fishbone diagrams. So now we'll get into the Plan, Do, Study, Act cycle itself, which is a series of activities used to achieve the process of system improvement, where we test change ideas to see whether they improve our processes. There are many benefits of using PDSA. PDSA uses a scientific approach for making improvements. And what that means is you think about why an issue is occurring, identify methods for overcoming that issue, and then test whether that was successful. The process is also structured and organized. It quickly identifies effective solutions. It reduces waste with small scale testing, which we'll get into a little bit later on. And it facilitates learning and sharing of ideas through regular documentation. So, why test? A couple of reasons. First off, testing can increase or decrease your belief that the change resulting from tests will result in improvement for everyone. Testing can allow you to better understand potential barriers and negative consequences before they grow larger, and build a network that can address them. And lastly, testing can identify problems in order to make adjustments that support equitable outcomes. So now we're really going to get into the different phases of the PDSA cycle. So the first step of the PDSA cycle is planning. Once the CQI team conducts root cause analysis and has identified the target area for improvement, what they believe is the root cause and the potential solutions, the team will then develop a strategy to solve the issue. There are some questions to consider during the planning phase of the cycle. The first being, what is the objective of the test? How will you carry out the cycle? The who, what, where, why, and when. How will you measure the impact of the test? How should data be collected? And lastly, how will you analyze your change strategy? The next phase of the cycle is the do phase. This is where the CQI team will implement the strategies of the plan for a set period. During the initial do phase, the CQI team should only conduct a small test to reduce the risk of large failure. Um, it should build on itself sequentially until the change plan is enacted program-wide. So you really want to test your strategy with one team, one worker, keep it small scale until you know that it's working. The do phase involves implementing your change strategy and collecting data at regular intervals. Like the plan phase, there are some questions to ask yourself as you implement. Have you implemented your change strategy? Are you collecting data at regular intervals? Have you made any adjustments to the change strategy based on your interactions with the data? And then these are some there are three different types of measures to collect in evaluating your change strategy. And we'll go through these. So first you have your process measures. These are used to understand how the change strategy was implemented. So for example, let's say our goal is to increase the number of participants enrolled by incentivizing participation in a program with a gift card. So we would want to know whether the gift cards are being distributed. That would be our process measure. Outcome measures are used to determine the results of the change plan and whether it was successful or not. This would be where you would look at enrollment numbers, presumably as a result of those gift cards. And lastly, balancing measures. These are used to identify the change plan, identify whether the change plan had any additional unintended consequences. For example, if current participants in the program learn of the gift card incentive, they might become upset and request gift cards as well. And then we have the study phase of our cycle. And during the study phase, you are regularly um, conducting the project. The program will need to collect data on those three measures we just reviewed, process outcome balancing, and study the results based on the collected data up to that point. And programs will need to carefully analyze the results and the implementation of the change plan. Like the other phases, there are some questions to consider while in the study phase of your cycle. What did you learn about your change strategy? Have you discussed the results with your team or other stakeholders? And how has your team summarized this information? The final phase of the PDSA cycle is ACT. This is where the CQI team, based on what they discovered in the study step, make a decision about what to do next. So the team really has three options, and these are adopt, adapt, and abandon. So the first is adopt. And this happens if the change plan produced the desired results and was implemented as designed. Then the CQI team can adopt the change strategy. And there are two options for how to go about this. So the first is that if the change strategy worked and the CQI team feels there is no additional information needed on how the change strategy will work on a larger scale, then they can implement the change strategy program-wide and it's done. The second option is to scale up or increase the size of the PDSA process within a ramp-up cycle. So even with that, there are a few things for CQI teams to consider. If it's the first test of a change strategy that yields promising results and changes are minor, it can be scaled up because there is evidence that the change strategy works and big failures are unlikely. And the scaling process should be purposeful and iterative, meaning each new test of a change strategy should be clearly related to that test. The scale of the test should be increased by just one increment at a time. Depending on the test, one increment should be one client or one home visitor. And tests of the change strategy should be scaled up or down based on results. So the second option within the ACT phase is adapt. Adapt occurs if the project did not produce the desired results or was not implemented as intended, but the possibility of making changes is available, then it should be adapted and retested in another PDSA cycle. The last option is abandon. And this would happen if the project did not produce the desired results and the possibility of making changes is not an option. Then your action would be to abandon the change plan and start again. And we'll walk through each of these in a bit more detail on the next few slides. So adopt. Like I mentioned in the previous slide, you would adopt if the change plan produced the desired results and was implemented as designed. So if the first test of a change strategy yields promising results and changes to it are minor, then you might want to scale up. If you're testing a change strategy with one staff member, you might expand to two. Again, the scaling process should be purposeful and iterative. Each test of the change strategy should be clearly related to the last test, and the scale of the test should be increased by one increment at a time, one client or visitor. And then you would scale up the result, scale up based on results. If you have already successfully scaled up your test, or if the CQI team feels as if there's no additional information, you would implement the change strategy program-wide or unit-wide or agency-wide, depending on the test in your organization. For example, if you're testing out a new data analysis software within your research unit, it might not make sense to scale up to other units. And if you feel that there are no changes necessary, you would adopt the change strategy as is. Then we have adapt. And again, you might find that you need to adapt if the project did not produce the desired outcome or was not implemented as intended, but the possibility of making a positive impact is still possible. And when you adapt, you must retest in another PDSA cycle. So let's walk through a quick example. So let's say you want participants to complete a survey after participating in your program. Originally, you'd provided a stamped envelope with a hard copy of the survey, and participants would complete the survey and then send it back on their own time via mail. Your change idea is to increase the number of responses by moving the survey online and providing them with a survey link after they complete the program. You test the change idea with a small group of participants and find that the response rate increased slightly, but not enough to adopt the change idea. So you adapt, you keep the survey online and bring a laptop to the final visit of the program and build in time so that participants can fill it out at the final visit. You test the adaptation in another cycle and find that this produces the results that you saw. So the adaptation worked. This slide is a visual of what the scaling process looks like. So as mentioned, a change might be piloted by 1 or 2 users in your very small scale test. If that's successful, you could conduct a follow-up test with a few more users. And if your initial change strategy required multiple changes, you would likely repeat that small scale test before expanding. Once your change strategy is found to be successful, you would expand your test to a wider scale test of change with even more users. And ultimately, you implement the change to the entire work unit or agency wide. And again, this will depend on the project and what level of scaling up is appropriate. And then we have abandon. So if you are unable to adapt or adopt, you would abandon your change idea. This would happen if your project did not produce the desired results. And this is important if the possibility of making changes is not an option. And in this situation, you would go back to the drawing table and develop a new change idea to test. So this concludes our presentation on the PDSA cycle. We are 3/4 of the way through our CQI workshop series. Our next pre-recorded workshop will be on lessons learned. Thank you.